What do TB IGRA results mean? Have you ever wondered what the results of a tuberculosis interferon-gamma releases assay, or IGRA, really mean? This blood test is designed to check how your immune system responds to the bacteria that cause tuberculosis, known as Mycobacterium tuberculosis. It specifically measures the releases of a substance called Interferon-Gamma by white blood cells when they come into contact with TB-specific antigens. This test can indicate if you've been infected with TB bacteria, including latent TB infection, but it does not tell you if you have active TB disease. So what does a positive IGRA result mean? A positive result indicates that your immune system has reacted to the TB bacteria, suggesting that you have been infected at some point. However, it's important to note that this does not confirm that you have active TB disease. To determine if you have active TB, further clinical evaluation is needed. This may include an assessment of symptoms, chest X-rays, and sputum tests. Now, what about a negative IGRA result? A negative result suggests that your immune system did not react to the TB antigens, indicating that there is no evidence of TB infection. However, false negatives can happen, especially in individuals with weakened immune systems, those who have been recently exposed to TB, or very young children. Therefore, a negative result does not completely rule out the possibility of TB, particularly if there is still a high clinical suspicion. Sometimes, you may receive an indeterminate or uncertain result. This can occur due to technical issues or factors related to your immune system. In these cases, retesting or using alternative diagnostic methods may be necessary to get a clearer picture. It's also worth mentioning that IGRA testing is often preferred over the traditional Tuberculin Skin Test. This is because the IGRA requires only one visit and is not affected by prior Bacillus calmette-guerin vaccination, which can lead to false positives in the skin test. Remember, IGRA results should always be interpreted in the context of clinical findings and individual risk factors for TB. A positive IGRA result will usually lead to further evaluation to rule out active TB and to consider preventive treatment for latent TB infection if active disease is excluded. On the other hand, while negative results lower the likelihood of infection, they do not completely eliminate the possibility. In summary, TB IGRA results can indicate whether your immune system recognizes TB bacteria. A positive result suggests infection but not active disease, while a negative result reduces the likelihood of infection but does not entirely rule it out. Always consult a healthcare professional for guidance on interpreting your results and determining the next steps.